When you measure your blood pressure at home, do you ever wonder what it means? Is it high? Is it low? Should you be worried about it? Watch this video to better understand your readings. There are two numbers in a blood pressure reading: the systolic blood pressure, which is the upper number, and the diastolic pressure, which is the bottom number. The systolic pressure now measures the force that your heart exerts on the walls of your arteries each time it beats. The diastolic pressure measures the force that your heart exerts on the walls of your arteries in between the beats. One big feature about blood pressure is that it tends to bounce around a lot. So just checking a few times a week or a month is usually not enough. The American Heart Association recommends what's called a baseline, or a group of about 12 measurements that are averaged together to estimate your true current blood pressure. It's done by checking both in the morning and in the evening for about 3 days. Each time you check your blood pressure, measure it 2 times, spaced no more than 1 minute apart. You can check your baseline at any time, but it's really most important to do it when you're new to the program, you're under more stress than usual, or when you have a change in things like BP medications or your routine or your lifestyle. You can also check it once a month if you don't measure often. This gives your care team and doctor a more clear idea of what's going on with your blood pressure patterns. Now let's talk about what goal you should set for blood pressure readings. According to the American Heart Association, blood pressure readings are classified into 5 categories: normal, elevated, hypertension stage 1, stage 2, and also crisis. But your goal might actually be different depending on your health conditions and your age. The general goal for patients with both diabetes and hypertension is to keep blood pressure under 140/90, or stage 1 or below, but ideally lower than 130/80, which is elevated or below, is a tighter goal that's recommended for people with a high risk of cardiovascular disease or those with kidney disease. So feel free to talk to your UnifiedCare team if you have any questions about the blood pressure readings, how to take your blood pressure baseline, or if you want more advice to keep your blood pressure controlled.
I hope you like this video. Go ahead and scroll through our website or our UnifiedCare app for more information about chronic conditions, vitals monitoring, and general nutrition and wellness. See you again soon.